Antenatal ultrasound diagnosis of partial acrania with neural and facial anomalies. This is a case presentation of a complex prenatal ultrasound case involving multiple cranial and facial anomalies. The fetus was evaluated via routine second trimester anomaly scan, and several major congenital abnormalities were identified, including partial acrania, presence of dysplastic brain tissue, encephalocele, and cleft palate. There was also fusion of the upper vertebral column. We will discuss the ultrasound findings in detail. Partial acrania. Acrania refers to partial or complete absence of cranial vault above the orbits, with the presence of disorganized brain tissue. In this case, the fetal skull vault was incompletely formed, predominantly absent over the parietal and occipital areas. The exposed cerebral tissue appeared irregular and echogenic, suggesting degeneration. The partial brain tissue which remained of the brain was dysplastic, unprotected, and showed abnormal morphology. There was no clear differentiation of cerebral hemispheres, and the structures appeared amorphous, indicating poor development. A midline occipital encephalocele is visualized. This is a protrusion of neural tissue through a skull defect. It contains both cerebrospinal fluid and brain tissue, confirming a complex neural tube defect. Here we can also see cleft palate. On coronal view of the face, a defect is revealed in the continuity of the palate, suggesting cleft palate. The maxillary segments appeared widely spaced with a potential midline defect. We can also see fusion of upper vertebral column, sagittal, and coronal spine views, revealing abnormal segmentation and fusion of the upper cervical vertebrae. This raises suspicion of an associated syndrome or sequence. Now, what are the differential considerations? This may be amniotic band syndrome, causing irregular cranial defects with associated facial and spinal anomalies. Neural tube defect spectrum can also be considered in this case, causing anencephaly and encephalocele. How to manage such cases? Multidisciplinary counseling is required. This case should be referred to fetal medicine specialist and genetic counselor. Parents should be counseled regarding the severe nature of the anomalies and poor prognosis. Karyotyping or genetic testing should also be advised to rule out chromosomal abnormalities or genetic syndromes. Termination of pregnancy. Given the extent and severity of anomalies incompatible with postnatal life, medical termination of pregnancy should be advised and counseling should be done to the family of the patient. Postnatal evaluation should be carried out if the pregnancy is continued. Delivery planning at a tertiary center with neurological and neonatal ICU is essential. Prognosis in such cases is extremely poor due to major central nervous system malformation, which is acrania, encephalocele, and dysplastic brain. Respiratory compromise due to cleft palate and brain stem involvement. Survival beyond birth would be unlikely, and even if born alive, the quality of life would severely be compromised. Thus, we can conclude this case highlights the value of detailed anomaly scanning in the early second trimester, and recognition of multiple major malformations allows for timely prenatal counseling, informed decision making, and appropriate pregnancy management.